Hello everyone, my name is Tan Jin Le from University Malaysia Sabah. Today I would like to talk about heart. Let's talk about heart anatomy. So what we can see in this infographic is the view from the anterior of the heart. We can see there's a vena cava, superior vena cava and inferior vena cava. After that, we can see the right atrium and also the right ventricle. In between the right ventricle and also the pulmonary trunk, there's a pulmonary valve. After that, we can see there's a pulmonary vein, which is connecting to the left atrium and left ventricle. After that, the left ventricle is connected to the aorta. And in between the left ventricle and also right ventricle, there's a septum. So the heart is a vital organ. There's 4 chambers, which is 2 atria receiving blood flow from the whole body and 2 ventricle pumping the blood to our whole body. Valves regulate blood flow. It powers the circulatory system, delivering oxygen and nutrients, and also essential for our life. Now, we talk about the function of human heart. First, we introduce about the 4 valves that present in our heart. The first one is the pulmonary valve. The second one is the tricuspid valve. And the third one is the aortic valve. And the fourth one is mitral valve. So, in overall, the function of the human heart is to circulate the blood in the circulatory system in order to transport substance in human body. The first physiology of our human heart is diastole. Diastole is the heart relaxation phase. During atrial diastole, atria fill with the blood, and during atrial diastole, the tricuspid valve and the bicuspid valve is closed. And in ventricular diastole, blood moves from atria to ventricles, preparing for the next contraction. At the same time, when the ventricular diastole, the semilunar valve that present in our human heart is closed, while the tricuspid and the bicuspid valve is remain open. Next, we move into the next phase is atrial systole. Atrial systole is the contraction of the atria, pushing the blood into the ventricle. It contributes to ventricular filling before ventricular systole, enhancing blood flow efficiency. At the same time, during atrial systole, the atrioventricular valve, which is the tricuspid valve and the bicuspid valve, is open to allow the blood to flow from the atria at both sides, which is left atria and also right atria, to pump the blood into the ventricles. Followed by the next phase is ventricular systole. Ventricular systole involves the contraction of the ventricle. During this ventricular systole, there is an isovolumetric contraction, precedes ejection, pumping the blood into the pulmonary artery and aorta, sustaining circulation. And this continuous phase, which is diastole, atrial systole, and ventricular systole, contributing to the physiology of the human heart. Next, we discuss about the biochemistry of the heart muscle. First is phase 0, which is the depolarization phase. During depolarization, there is a rapid increase in membrane potential. which is the sodium channels open allow the sodium ion influx that cause a rapid increase in the membrane potential that we can see in this graph. Next, followed by the phase 1, initial repolarization. Initial repolarization, there is a brief decrease in membrane potential due to the transient outward potential channel open. So there is a brief decrease in the membrane potential in phase 1. After that is phase 2, which is plateau region. There is a membrane potential remains constant due to the balance of the calcium influx and the potassium efflux. So they can achieve a balance in the membrane potential in phase 2. Followed by phase 3, which is repolarization, means that membrane potential decrease in phase 3 due to the potassium channels open, allowing K plus influx. After that, which is the last phase, is phase 4, resting membrane potential. The membrane potential will back to the resting membrane potential, which is the resting stage between action potential, where there is a balanced movement of ion can be maintained in the membrane potential of the heart muscle. And that's all from the biochemistry of the heart muscle. Thank you. So let's discuss about some of the cardiovascular disease. First is coronary artery disease, which is CAD, which is caused by the buildup of plaque in coronary arteries, which is reducing blood flow to the heart. So we can use coronary artery bypass grafting, which is CABG, to treat this disease. This coronary artery bypass, which is a surgical procedure to bypass blocked arteries and redirecting blood flow. The second disease that we stand in this infographic is valvular heart disease, which is the malfunction of heart valve affecting blood flow within the heart. We can treat it with valve replacement or repair. That is a surgical intervention to repair or replace the malfunctioning heart valve to restore normal blood flow for the heart. Now we move on to the symptoms. First, if in our human body we can feel chest pain or discomfort, means that we're getting a cardiovascular disease in our body, which is there's a pressure, squeezing, fullness or pain in the chest, often known as angina. Second, if we feel shortness of breath, which is also one of the cause of getting cardiovascular disease. Shortness of breath means that there's a difficulty breathing or catchy breath, especially during physical activity. The third one is fatigue, which is unexplained tiredness, weakness, or feeling of exhaustion in our human body. So these three symptoms can leading to getting cardiovascular disease in the human body. Finally, we discuss about the prevention for the cardiovascular disease. In a quest for ultimate health, consider a holistic approach to well-being. Regular exercise, at least 150 minutes per week, strengthens your cardiovascular system and also promote overall fitness. Maintaining a balanced diet and staying physically active reduce the risk of heart disease and diabetes. Stress management, through practice like meditation and yoga, safeguards mental and physical health. Regular health checkups are vital for early detection for the potential issues ensuring timely intervention, limiting alcohol intake, and also quitting smoking significantly decrease the risk of various health problems. Embrace this preventative measure for healthier and more fulfilling life. And that's all from me. Thank you.